Good morning, everyone. Thank you so much to the Being team for having me. Yes, my name is Evelyne. It rhymes with tortellini, if you get lost. That's the best way to pronounce it. Evelyne Tortellini. My friends used to call me Tortellini as my nickname. Anyway, I am the new CEO for the Mental Health Coordinating Council. I'm taking over from Carmel Tebbit, who has done a wonderful and amazing job in the sector, and 7 weeks in. So forgive me if I fumble through this presentation. It is highly likely. I just want to start by making sure I can work this clicker. In the spirit of reconciliation, I acknowledge the traditional owners of the land on which we meet, the land of the Gadigal people of the Eora Nation. I pay my respects to their elders, both past, present and emerging, and their connections to land, water and culture. I also recognise and appreciate those with lived experience and mental health conditions and trauma, their families and carers, including those here today. Your voices are powerful and vital to advocacy and reform processes across the mental health services sector. I also, on a personal note, just want to say that participating yesterday and obviously this morning, I'm just seeing the passion and the energy, and I'd have to say the bravery and courage in the room, which is incredibly inspiring. So thank you for allowing me to be a part of it. Today I'm just going to cover 4 key things. The Mental Health Coordinating Council, or MHCC. I know that in the room we've got some new peer workers, but I also acknowledge that even celebrating Paula's 25 years in the sector, we've got a wealth of experience in the room as well. So bear with me if you already know about MHCC, for those who don't know about it. The importance of training for peer workers, peer work training at MHCC and what we deliver there, and future training needs as we've had fed back to us. So Mental Health Coordinating Council celebrates its 40th anniversary this year, which is really exciting. We are the peak body for community mental health organisations. We've got 80 members spread across all of New South Wales, and some of those organisations are national organisations, and we've got regional and metro representation. And of course we encourage you, if you're not already a member, to become a member. We do a workforce survey every second year, and our next one is about to be launched later in the year. And our latest workforce survey indicates that 27% of the mental health workforce is actually in the CMO sector. Community-based mental health is a key pillar of mental health. I don't think I'm telling you anything you don't already know. We also have a key part of what we do, other than advocacy and representation of our CMOs, is the Learning and Development Arm, which is a registered training organisation. It provides accredited and non-accredited training. And I've been asked today to specifically talk about Peer Work Cert 4, but I just want to acknowledge that we also have a range of other courses available. You can look up our website and we've got a full training calendar. We've got things like the Introduction to Trauma, Safety Making, Living with Trauma, Vicarious Trauma, Introduction to Motivational Interviewing. There's the Advanced Motivational Interviewing, Responding to Voices, Peer Leadership Skill Set, and Managing Workers with Lived Experience. I've also just want to throw in a quick plug that we are a founding member of COMDAN, the Community Mental Health Drug and Alcohol Network, and we've just released a co-production Kickstarter, so you can get that at the stall outside in the reception area. So I encourage you to take a look at it and spread the word. The other thing that we are a founding member of is Community Mental Health Australia, which is basically the sister peaks across the state form the Community Mental Health Australia. So we also give that national representation of what's happening or what needs to be happening and where the focus areas need to be. So what is the importance of training for peer workers? Before I go through to the slide and the script as such that's there's 2 things that I want to acknowledge. I know that the commentary and debate is often that lived experience should be sufficient and you shouldn't need to get a qualification, so I just want to recognise that. And the other thing to recognise is that there's frustration amongst peer workers, rightly so, that there's an assumption there is no qualification, that they're coming into the organisations that they're working for. And a lot of the peer workers that are in this room are coming in with a myriad of qualifications. I've spoken to GPs who are peer workers, I've spoken to psychiatrists, I've spoken to social workers, OTs, and the list goes on. So I just want to recognise that before I go into why you should do some training with us. So I think it's important to have that lifelong and curious mindset. My dad passed away some 7 years ago and at the age of 74, but he had a constant learning mindset, so that every day I walked in on him, he was still learning something. So I think it's all important for all of us to just constantly have that curious mindset and keep adding to the toolbox of skill set. Learning how to use lived experience through best practice training, education and continued professional development. The qualification of lived experience as shareable knowledge can transform stigmatised behaviour into an asset. Increasing competency to help others connect, reciprocate and reduce social isolation. Learn how to work with cross-disciplinary teams if you don't already do that, and support role clarity. And I was reading somewhere, don't ask me where I read it, but it was important to note that the peer workforce is the fastest growing mental health workforce in Australia. So acknowledging what we've just said to the Minister about wanting to increase our peer workforce, but we are one of the growest workforce sections. The importance of training for peer workers, just a few more things. Helping to build resilience in the face of stigma, and that's supposed to be discrimination. The purposefulness of disclosure and continuing to gain confidence as to when to disclose to others and colleagues. Creating safety in practice. Support with developing boundaries. Building a network of peers. Sharing strategies and resources useful in facing challenges with the aim of strengthening self-efficacy and re-empowerment. So as for our Cert 4, I just also, before I go into the detail of this slide, want to acknowledge two things. I know we have a waiting list and it just speaks to the demand in the sector. So please keep adding your expressions of interest and I'll give you the details at the end for those that are interested. We're hoping to release some more courses soon. But the other thing to add to that is that we're looking for more trainers. So Jo is our wonderful peer work trainer at the moment. She'll be at the stall to answer any questions, but we are looking for more to meet the demand, particularly regional rural areas. So if you are interested, please put in an expression of interest. And if you're on our list, you would have already seen that advertised. But if you're not on our list, you can also go to the stall and there's a QR code. You can just log into that and get on our list so that you get information about our training programs. But as for the Cert 4 in mental health peer work, it's a nationally recognised qualification for people with lived experience in mental health distress as either a consumer peer worker or a carer peer worker. There is the opportunity to work in the mental health services in roles that support consumer peers or carer peers. No prior qualification and some work experience of or consolidation of on-the-job experience and learning is a requirement. There's a few other eligibility criteria. You've got to be 18 years or over, no longer in secondary education, Australian or New Zealand citizen, permanent residence visa holders and migrant refugee. You've just got to have the bridging visa for work and study rights. Lived experience of a mental health condition you would assume is an eligibility requirement, as it is. Able to meet the attendance and study requirements, which I will go into shortly. What you need to do, you need to be able to have the ability to secure a paid or unpaid work placement opportunity in the mental health consumer or carer peer worker role with a mental health service provider prior to enrolling in the course. This can be an existing employment or a work placement sourced by the student. We don't assist with providing that placement or pre-placement work. Have a workplace supervisor or manager willing to provide evidence of the student's competency in the unit's qualifications as part of that work placement. Little bit more, you need to be able to meet the attendance and study requirements, as I think I mentioned earlier. You do have to do an online numeracy and literacy skills assessment. It is very basic, just prior to enrolment in the course can be confirmed. Students will be required to have regular access to computers, internet, and you can almost do it all on your phone these days. What's involved? So it is a 12-month course. I got some feedback yesterday that that's quite onerous. Unfortunately, because it is a nationally recognised qualification, there's minimum standards that we have to make sure all students adhere to. It is 40 hours of virtual classroom and supported paced learning and assessments, 15 units of competency and core electives, and 120 hours must be completed in placement. Some of you may be familiar with our fast track mode for the Certificate 4. Unfortunately, that's just been put on hold for a moment because we need to make sure that we're adhering to some suggested requirements for competency. So that will hopefully be reinvigorated very soon. And work placement can be paid or unpaid, just for clarifying that. So topics that are covered in the certification, you'll learn safe storytelling and ways of sharing your experience, recovery and trauma-informed care, understanding and responding to suicide, undertake peer work practices, navigating the mental health system, work with diverse people, promote self-advocacy, and work with impacted families. And that's done through a blend of theory and practice and discussions. So why study with us? We are the peak body for community mental health organisations in New South Wales. All trainers are experienced mental health peer workers and have lived experience. Flexible and self-paced learning are supported during the course, and I'll talk to you a little bit about how we do that, and subsidies are available for eligible participants. The fees are subsidised in most cases through fee-free scholarships, say that 3 times fast, smart and skilled funding, free exemptions and concessions, and I've just provided there a link to the website which you can get more information. I won't go into the detail of all the scholarship requirements, etc. You can get that information through the website. So how will you be supported? I know that, working full-time or part-time, and if you've got family commitments and carer, and obviously you may also be on your own recovery journey, it can be really hard to fit in study on top of that. So you do get 12 months to do the course, but we can give you up to 2 years, and this is not MHCC, this is a requirement under the national standards. You can get up to 2 years to complete the course as long as you provide valid reasons. Friendly and knowledgeable trainers, including Joe with us again, and a student support team to assist you. All webinars are led in a trauma-informed and recovery-oriented framework, and assessment drop-in times are available with the trainers for one-on-one support as needed. So just some student feedback. Classes were interesting even though they were wholly conducted online. The support from the admin staff was exceptional. Trainer was so knowledgeable, respectful and patient. She was generous in sharing her lived experience and mindful when she shared her own opinions. The trainer made the times, and I'm not wearing my glasses and I can't read that font. The teacher had incredible knowledge and great connection with the class. I'll leave you to read the last one. So how do you enrol? Check our website for details, but the quickest thing if you have any questions is to email the address at the bottom, training@mhcc.org.au. That's training@mhcc.org.au. And as I said, get to the QR code at the store where you can get information about the newsletter and access that frequently. This is just our website. I should have actually done a snapshot of all the training that's available, but again, you can get that through our website. I was also asked today to speak about future training needs for peer workers, and I couldn't help myself because that's the advocacy spirit, to talk about supporting non-peer workers and the training that's required potentially for non-peer workers to better understand the role of peer workers, including addressing challenges of direct and indirect expressions of stigma and prejudice from colleagues, recovery-oriented practice and trauma-informed care in the work environment. And of course, the feedback we've got from our own peer workers and peer workers in the CMO sector is to continue to be leaders and champions and advocates for cultural change in progressing the peer workforce, recovery-oriented practice and trauma-informed care. It really does need to start with the leadership, and we need to drive culture of having peer workers embedded everywhere and not just the tokenistic one. There needs to be a support network for peer workers who can work collegially together. Continued mentoring, training, supervision and support. I think we've heard that repeatedly. I think it's over the 25 years that the network has been involved, has been operating, and obviously differentiating between administration supervision or line management supervision and clinical supervision. Whether it's internal, whether it's external, it doesn't matter. There just needs to be more of it. And just future training and progressing professional development in that space. And as I said earlier, just having that constant mindset of learning and growing. So we've just got on scope with the RTO, the Peer Leadership Skills course, which is a new program for us. I have no idea how I'm going for time, but just as well, because I think this is the last slide. So, as I said before, inquiries, just go to training@mhcc if you have any inquiries. Otherwise, you can go to our website, visit the stall so that you can get access to the QR code. And I'm going to hand over back to Helen, who could probably give me an idea of time and whether we've got time for any questions. Thank you.
You fortunately started slightly early, so yes, there's time for a question or two. Let's go with a live one while I'm finding it. Yes.
Do I have to repeat the question?
I could do it quickly for you. So if I've understood the question, it is about providing training for those working with peer workers. Is that correct?
No. So intentional peer support is another, I suppose, course that I'm sure a lot of peers here have undertaken. I'm just wondering if the MHCC, along with the Cert 4, would be looking at it's an internationally recognised course. So whether or not the MHCC would be looking at possibly providing that as well.
Okay, I don't know the answer to that, so let me take it on notice, and I'll have to get it back through being to get you the answer to that. But thank you for the question.
Evelyne, we have a voted up question now for you. So would another level of qualifications be beneficial for peer workers, such as a diploma or even a bachelor's?
Absolutely. Whether we can get it on scope or not, so if anyone knows anything about RTOs, getting anything on scope is a challenge with limited resources and limited funding. So we were very excited to get the peer leadership skills one on scope. That took, I think, over 12 months to get on scope. But absolutely, the diploma and bachelor, what a great idea. So I'll take that one on notice as something to consider. Thank you.
Evelyne, we have one now around recognition of past work. So I'm going to read it from the start, it's a longer one. Many, if not all, peers have had multiple employment and education experiences before they enter professional peer worker roles. Question, how can we recognise the skills and qualifications from diverse industries, I'm sorry, it's just jumped on my screen, to ensure peer workers are being recompensed in a valuable way which recognises prior knowledge and attributes?
Absolutely, and that's what I was alluding to before about making sure that lived experience is recognised, and that should be sufficient, as well as any other training you might have. There is something called RPL, Recognition of Prior Learning, and particularly for Cert 4 in mental health peer work, there is a mapping exercise, so you can submit evidence to suggest that you've done all the requirements. Again, it's a national accreditation requirement, so it's not something that we can tick off. We've got something that we have to align to make sure that you actually meet the requirements. But RPL is absolutely something that exists.
Thank you, Evelyne. Next question is about Cert 4. Peer workers start in jobs and undertake the Cert 4 and peer work. Takes a year from registration to complete. What training can peers access in the meantime while they're in a peer role?
While they're doing the Cert 4?
Yep.
Well, I don't know that you want to do any more. But if you are curious and have a continued mindset...
so just re-looking at it, I think it's while they're waiting for the year to be up to then be able to take the Cert 4. Does that sound right to people?
Yeah, that's right.
Yeah.
So normally the Cert 4 takes 12 months to do, and I would suggest that you focus on doing just the Cert 4. If you want to access other training while doing the Cert 4, we've got the trauma informed, we've got the motivational interviewing, we've got a range of other questions that have just popped up, so I might be saying something wrong. So Ryan,
I think it's more that I've misinterpreted the question. So if we pop over here, if that's okay, and just
yeah, I've got a question, but maybe they could go to Recovery College while they're waiting, if they're in the district, or I'm not sure, but that's not what I was wanting to ask. What I was wanting to ask is that you've got grants and scholarships and training, and there's student placement, and there's mentoringship, but there's a missing link there that we don't have students that we're mentoring within the hospital system that are going through the MHCC, and who will pay for the insurance for those students, because we are passionate and we do want to ensure that we're holding people in peer work and mentoringship and supervision and all those things. It would be good if we had students, just like all the other disciplines. There's nurses, there's OTs, there's social workers, there's EPs, and I think there should be peers as well.
Yeah, that's a great question. I've been locked out of the system. I was going to go back to the work placement requirements. So the work placement requirements, you actually have to, it's going to take me too long to get back, that's okay. Workplace requirements, you can have paid or unpaid, and that sits with the student and their employer or whoever the entity is that's going to take them on in terms of volunteering. So the liability and the insurance sits with the employer. So in the public health system, it'll be New South Wales Health that would take the liability for, liability is an insurance, not liability in any other term. So they would take on the insurance liability for taking on peer workers within the hospital system. It wouldn't be MHCC. Does that answer your question? Thank you.